Okay, thank you, everyone. My name is Loreen Akinyi. I'm part of the My One Health International Patient Support team. So I'll be your host today as we welcome one of our partners, that is Saudi German Hospital, Saudi Arabia, from the Kingdom of Saudi Arabia. With me is my co-host, also part of the patient support specialist team. She's Mukami Nganga. She'll be our co-host for today. So I'll just let Mukami take us through My One Health, and then we'll continue from there. Welcome, Mukami.
Thank you. Thank you so much, Akin. So my name is Mukami, as Lauren has mentioned. I will be taking you through My One Health and what we do as My One Health. So My One Health is a medical facilitator whose purpose is to transform how patients access specialized medical care globally. Since inception, we have partnered up with a total of over 350 facilities, that is hospitals and clinics globally. We have also managed to assist over 50,000 patients from all different parts of the world. We do have offices in the UAE and in Kenya, that is where we currently are. And we are honored today to co-host this webinar with one of our partner facilities, that is Saudi German Hospital in Saudi Arabia. So I'll give it over to Lauren to introduce our co-hosts who are going to take us through Saudi German. Over to you, Lauren.
Thank you again, Mukami. So we'll just move straight into it. So we'll basically be talking about the Saudi German Hospital in Saudi Arabia. So Saudi German Hospital is one of the top facilities in Saudi Arabia. It started its operation around 35 years ago, and some of the top specialties around Saudi German is cardiology, neurosurgery, orthopedic, oncology, and organ transplantation, among others. So with us on call today, we have guest speakers from the facility itself. So I'll just be introducing them so they can take us through the facility and what they do and how best we can work together. So with us on call is Mr. Ahmed Musa. This is the Group International Sales Manager. Aside from Ahmed, we have Mr. Mahmoud Farhat, the Group International Operations Manager. And lastly would be Ms. Noof Al-Sharif, the Group Sales Planning Director. So I'll just hand back the mic to Mr. Ahmed, who will be taking us through their presentation today so we can get to know more about Saudi German as a whole. Welcome, Ahmed.
Welcome, Lauren. How are you? In the beginning, I would like to thank Eve and you and all the team of My One Health for that chance. As usual, your support for more than 5 years with the Saudi German in Egypt, in Kingdom Saudi Arabia, and all the regions with the international cases. Let's start with the sharing of our presentation. Do you see the screen?
Nothing yet, Ahmed.
Now it's appear.
Yes, it is.
Okay. My name is Ahmed Musa. I'm a doctor in the title of Group International Sales Manager. for Saudi German health group with more than 16 branches of hospitals in GCC and Africa. We will take you on a story of the Saudi German overview of the market of Saudi Kingdom, Saudi Arabia, of international cases, of local insurance, potential branches, all the story to see how the Kingdom Saudi Arabia improved in the last 10 years in the healthcare, how Saudi German group, and it's not one hospital, it's a group of the hospitals, moving well with that. Number one, we're talking about the facility and the patient that we can meet with that all. We are moving through 8 hospitals in Kingdom Saudi Arabia. And by the way, through the story, you will not find a group of hospitals like Saudi German distribute in more than 5 countries. But today we will working on Kingdom Saudi Arabia, 8 hospitals, more than 1.5 thousand bed operation capacity for the 7 branches or 8 branches in Saudi Arabia, 90% population access through Saudi German group inside and outside, 7.8 thousand total staff working in the Saudi German hospitals, 1.5 thousand total doctors, 2.6 thousand total nurses. You will find different record with the people can serving your patient in Saudi German. The average length of stay at 3.6, which is matching with the worldwide standards. 68% utilizing grade, which means all the time you will find a place for your case, for your patients. 72% utilizing grade in clinics. 677,000 inpatient cases. And that record in the last 10 years. 15 million outpatient census, and that real count of the cases going through Saudi German, 380,000 performance surgery. When we go through that numbers, you will find a huge qualified service numbers with all that stuff you can see in the Saudi German. Sorry, because the movement is very not easy. The vision of Saudi German is to be the most accessible, agile healthcare group in the region, and that providing innovative and comprehensive patient-centric care to all patients anywhere and anytime. And that we will show that through the branches different in Saudi German and Kingdom Saudi Arabia to cover that needs. The mission to do that, to provide evidence-based, safe medical services delivered with effective management, engagement with our community, and the fulfillment of our stakeholder needs. Both vision and mission, we're working on that through more than 30 years ago, and it's reached the maximum within the last 5 years through the great owners and leaders in C-level, starting with Engineer Subhi Batarji. Engineer Subhi Batarji was starting the group in 1988, and Mr. Makarim Batarji, our President Vice Chairman, coming the leading for that, and supported by the Dr. Ahmed Shebl, the group chief executive officer, more than 10 CEOs in the group, and Mr. Madani Hussein, the other arm of financial CFO. And that showing you the diversification of the nationalities inside the group and the leaders coming to the future. The history starting with Saudi German in 1988 and Mr. Njili Subhi Batarji starting with his brother Khalid Batarji. He's a professor in the orthopedics and already getting the certificates from Germany. And from this time, they creating the Saudi German and the name created from that time under professors from Germany in 1988. And we starting through the old branding of Saudi German, as you see in the screen. And in 2021, we changed the branding for the heart to be with heart and caring family, as we said, as usual. And it's not only a hospitals working. This is a organized MICO office, Middle East Authority company to organize the business and the cases inside and outside Saudi Arabia. That's why you will find a full team of senior managements controlling the business, controlling your case, controlling the teams inside and outside the hospital. The journey starting in 1988 in Jeddah branch. Jeddah is a city, commercial city, as known from more than 50 years as a commercial city in Saudi Arabia. That's why Saudi German is starting in Jeddah with the first branch. And then moving to Asir. Asir, it's the touristic area in the south Saudi Arabia. I will show the map in the next slide for that. The touristic area to covering the not only medical tourism and also the wellness tourism. Because if your patient need a wellness tourism, not only medical, we can cover the case of that. Then in 2001, we moved to Riyadh, the capital of Saudi Arabia, to be in centric of the most diplomatic and potential organizations, international organizations around the capital. In 2003, we go in Medina, which is the second city, religious city in Saudi Arabia, which is very potential and in the west side. And then moving for the north of Saudi Arabia with Hayl branch to covering most of the countries in the north, like Iraq, Jordan, Syria. And then in Jeddah, we open another clinics to covering another part of the city, because Jeddah, one of the big cities in Saudi Arabia. That's why we creating a new clinic in Jeddah. In 2020, we offering the Riyadh by establish clinics, new clinics, and open Dammam branch. Dammam city is in the west, in the east side of Saudi Arabia, which is covering all the GCC countries and part of Asia. In 2021, we go to remembering to the branding of the Saudi German Health, as I said before. In 22, we do a doubling in clinic specialized in the Jeddah and in clinics in Abha, which is Abha area of part of Afsir in the south, and opening Mecca branch with the first city or religious city for the Hajj and Umrah cases. And at the end, expanding the Riyadh toward the big medical tower in Riyadh to covering the other part of the city. As you see, in Saudi Arabia, this is the region 7 branches. In UAE, we have 3 branches. In Egypt, we have 2 branches. In Yemen, we have 1 branch. And very soon, we will open a branch in Morocco and in Pakistan. This is the plan. We working on it from maybe more than 30 years, as Engineer Subhi said. We're starting in Saudi Arabia, but we will covering the region to cover Africa, Asia, we're covering Middle Eastern, the upper side, and also the thinking to open in Asia branches very, very, very soon. 4 countries, you will not find a group covering or hospitals with these branches covering countries and with 14 branches, 35 years, and 44 specialties and subspecialties later we will as we see. To complete or to be professional, we're going through the certificates And this part of certificates you will find in Saudi German, starting with the GCI, as all the international cases searching for the GCI or GCI certified hospitals, Platitude for the patient safety, CAP for the accreditation for the laboratory, and you will find the developing unit for the nursing, and you will find more than six certificates later for the nursing, because this is the second line in the hospital with powerful potential for your cases. Hence, for the IT, because we're looking only updated technology, AI machines, equipment everywhere, the developing associated advanced blood bank, and the Sibahi, one of the Saudi certificates accreditation, and also under controlling of the Organization of Health specialized in Saudi Arabia for the programs. We are seeking last 5 years for one of more potential topic, which is value-based healthcare programs and certificates. And ASHOM, it's one of the potential one. What is the meaning of value-based healthcare? Value-based healthcare, which means your case coming for the hospital and getting the most qualified service, plus within affordable or reasonable prices, which means the value not exceeding equal to the facility or the luxury level or the staff level or the accommodation level inside. And already accredited for the 3 cities or 3 branches, Riyadh, Jeddah, and Asir. And also, we are now trending and leading the training academy for the value-based healthcare for all the group of healthcare in Saudi Arabia. Here, this some numbers maybe can show you the potential of Saudi Arabia and the potential of healthcare in Saudi Arabia. You will find 72% between the inpatient and outpatient, 72 to 28 non-Saudi. And the growth inside through the MOH, Ministry of Health, over the government sectors and the insurance and the private sectors through the last 5 years. The same in the outpatient, 70%, 75% for the Saudi, 25% in non-Saudi, and the same for the outpatient inside the MOH, private sector, and the governmental sector. The capacity of beds here, always we show from this slide that 20% saving beds for the international. And the international here, it means not the international inside Saudi Arabia, the international patient coming out of Saudi Arabia, which means all the time you will find a space or bed for your case. It's not fully occupied from inside, especially with that group. The growing from 2018 to 2023 in the bed capacity, covering 80%, which is meeting the standards of most of the medical tourism sectors or region. In Saudi Arabia, you will find 24 insurance companies within 13.2 million Council of Health Insurance beneficiaries, which is covering, as you see, the growing of the business inside Saudi Arabia, the growing of the healthcare inside Saudi Arabia, the potential of the healthcare inside Saudi Arabia, and you will find last 3 years the growing in the non-Saudi cases inside Saudi Arabia. The potential in Saudi Arabia now supported by the MOH, by the Ministry of Finance, Ministry of Tourism in the same side, as per the vision of Saudi Arabia in 2030. And as per that vision, you will find the collaboration between Ministry of Health and Ministry of Tourism and Ministry of Finance. And by the way, our boss, Ms. Nofis Sharif, she's the strategic and sales planning director in Saudi German. She's member in the MOH committee for the medical tourism. Because we are the first group in Saudi Arabia working in the medical tourism more than 10 years, and they recommended us to be a part of the committee of medical tourism team to put the policies and creating the new ideas and support the idea of medical tourism in Saudi Arabia, which means you are powered by MOH and the team of SGH in the same side. And they are looking for the positioning Kingdom Saudi Arabia as a hot spot and hot area for the medical tourism and the hub of medical tourism in the region of Middle East, Africa, and the Islamic countries, as they said in the MENA region. Creating opportunity and healthcare logistics, we have team working on that. Supply chain, finance, RCM, revenue cycle management. They are working on all the invoices and every day with the team of 400 person working on that to create the most affordable packages for the international cases. Digital health, we are updated every year for the group by the most updated equipment, and especially in the most potential surgeries and updates. Also, we are moving with the vision of 2030 of Saudi Arabia, traveling economy as a part of economy in most of medical tourism companies, ambitious nation, and the Saudis now working in all parameters, supporting the international cases and investment and health and everything. Vibrant society inside this, all the organizations, improving the quality of healthcare and all members and staff of the healthcare, improve the access care of with doctors, increase the employment satisfaction, because if our employees satisfied, they will support more your cases, better efficiency of care, and that's supported by value-based healthcare in SGH or Saudi German group. The good thing that the cycle is starting with advanced treatment technology, customized medical care. That means whatever your case need, it's not exclusive with one package. Even with the simple thing like the checkup. We have more than 20 kind of checkup, different and tailored on the cases. Multidisciplinary team. You will find your international patient who are working with in each branch with international member, with guest relation member, with finance member, with RCM member, with marketing member. All that team support you the cycle of the patient, as we will mention in the coming slides. International visiting professor. We have more than 15 professor coming from Europe and Arabian countries, and they are staff professional for the very specialized and subspecialty cases. Comprehensive multicultural team to working with all the cultures and language. State of art in the facility. And by the way, the 7 branches or 8 branches in Kingdom Saudi Arabia, it's not small branches. The size of the capacity bed in each one, starting with 200 bed and more, reach to 300 in some of branches. Safe and reliable surgical procedures. We now ranked one of the high successful operational hospital, exceeding the 92% in the all operations. International facility affiliation with My Clinic, as you said in the top here. My Clinic, the top of USA, and we affiliated with My Clinic more than 15 years ago. Accommodates international patients and easy to access, and we will show easy to access through the online application, phone, emails, through our colleagues or cooperation team in My One Health. You will find us. The turnaround revolution in Saudi Arabia and the healthcare in Saudi Arabia through the integration, diversification, digital transformation, accreditation, which maybe every 6 months we have a new accreditation, and I will send to Eve and the team of My One Health all the link of website of the social media to see the updates of accreditation for the Saudi German restructuring as we improve the structures of the our facilities, the update of the beds, of the buildings, of the new clinics. Cost efficiency, as we said, value-based healthcare, technology, and patient satisfaction. We have more than 5 programs working on the patient satisfaction in Saudi German Group. As usual, the framework of the structure, we are working from last 2 years on the subspecialty developments. And there is more subspecialties, more sophisticated specialties. and dedicated for the last maybe 5 or 6 years in the patients, searching for the subspecialties everywhere. And we are working on that more than 2 years. And now we have more than 6 excellent programs and departments in oncology, cardiovascular, orthopaedics, pulmonary and chest group, and GIT, and the pediatrics for the subspecialties. Education and training, we are not only educate our doctors and nursing, we have our medical college under the name of Batarji Medical College, and we creating annual team on members of doctors trained on Saudi Arabia. Quality assurance, we have in each branch a quality team, and also the organized by the central team in the MICO group. The growth here in the healthcare and subspecialty and operational acts and the financial acts, as you see the growth from 2023 to 2024 in the specialized medical staff, from 279 to 356, and enhancing the case mix to covering all the cases coming from inside and inside, improve the DRG, the diagnostic related groups, and positioning of that through the staff of medical, direct alignment with Saudi Vision 2030, and we are member in the MOH Committee for the Medical Tourism to putting the policies and the updates, optimize the cost, and that one of the arms, maybe can the patient select the facility or not, and we are working with the finance team on that. Strengthened market positioning in the Middle East and in the region, and maybe you can see that in the social media and website and the movement of that. Saudi German Hospital is the first group doing many of the sophisticated and subspecialty and low-standing operations, like total hip replacement, liver transplant, cochlear implants, laparoscopy, colonoscopy, and the spine instrument in the scoliosis in Saudi Arabia. We are the first group doing that operations, and the other following the trend through our medical staff team. Transforming the medical programs and delivery benefits, educated achievement. We have and did the programs expanding from 21 to 37, raised specialties, and the physician increased from 31 to 110, which means the most growth in the medical cases and the medical expansion of the facilities, and institutional accreditation growth from 6 to 7 facilities, because we are not accredited in the group, we accredited by facility in the SGH group. Cost optimizing, as usual, we have to talking about the cost and the high cost registered patients, improved the CHI corporate health insurance, and ranking with the insurance company inside and outside. And by the way, we are working with more than 120 international insurance through the TPA, direct from them, through the brokers, through the referral companies, enhancing the operational efficiency, and that through the service delivery coming through the international team, the medical staff. We are growing to 59 programs by 2025, and that coming for the equation of the medical facility, the achievement of education, the strategic benefits, the financial goals with the medical target. As I said before, we are focusing on the most powerful second line, which is the nursing. You will find more than 6 accreditation for the nursing from 2022 till 2025, as segment accreditation for the nursing in Saudi Arabia and Sigma and different USA, because the second line, it's the most important after the operation or the following the operation and procedures of the cases, and we know enough how to carry in that. Let's go for the international case. What moving people from their home country to the other country to find the medical treatment or the wellness treatment. High quality, high saving, latest technology, customer care, world-class facility, no waiting list, best surgeon, travel package. And that package, all the people maybe ignoring the waiting list, maybe ignoring the high class, but they cannot ignoring the high quality treatment or saving or technology or the customer care. By the way, all that parameters in the group of Saudi German, we are achieving all that by 100% now in 2025. Who the team working on that? All the sales, RCM, revenue cycle management, medical, marketing, accounting for the patient journey inside Saudi German to achieving the high quality service with value-based healthcare, as we said before. The patient coming from embassy, TPA, third-party administrator, brokers, going through the medical evaluation, cost estimation, emergency through the emergency or OBD or online consultation, coming for the inpatient or outpatient, the invoices, patient experience, account, feedback, all that cycle as a working team on that, starting with your patient, maybe by call, maybe by email, maybe coming by online consultation, as we will see in the coming slides. At the end, they will coming for the team, know how to move the cycle of the patient inside Saudi German group. What are the main specialties? What are the main cases? As we see through the male and female, 80 to 20%, the 80 for the basic line, transplant, kidney, liver, and bone marrow transplant, cardiology by all subspecialty, neurosurgery by all subspecialty, oncology by all subspecialty, and orthopaedics by all subspecialty. After the analysis of last 5 years, most cases coming through this baseline or first line operations or procedures. Second line coming through the OB/GYN and mainly IVF, plastic surgery, cosmetics, gastroenterology, and pediatrics. And more than that in Saudi German group, and more than that we can do inside Saudi German group. This some photos and pictures for our facilities, hospital kind of rooms, the beds of the ICU, the NICU for the neonatal, some clinics, and the reception of the facility. By the way, if we go for any of our facility, when you go inside, you will find the same structure. You cannot feel stranger in everything in that difference. As I said before, Western doctors, visiting program doctors, we receive doctors and consultants from more than 10 European and Arabian countries, Germany, England, Italy, USA, most of them coming in regular base, and we announce on that in our social media and our website if your case interesting in that. One of our way to receive our cases, the online consultation. Online consultation, you can ask your case, or your case can ask for the second opinion with full treatment plan, with cost estimation through the online consultation. Full name, email, the number, branch, even he can select the branch, details of the case, and attach all files. And we reply within 24 hours for all cases by official letter, treatment plan. Maybe that letter can supported by visa letter to support cases traveling from Africa or any country to SGH, Saudi Arabia. Kind of cultural and high class end of our rooms, because we have maybe 3 grades of room: double room, single room, the regular room, and suite room. By the way, we are working on the value-based healthcare and cost efficiently with the cases. You will not find that exceeding any countries or facility, even in Europe, in India, in South Africa, and everywhere, you will find the equal price with the same professionality or more. This sample of our numbers last year from 2023 to 2024 in different specialties. And by the way, that the total number last 3 years, it was 500 cases. And these cases, it's only for the medical tourism, because for the Hajj and Umrah international cases, it's exceeding the 50,000 case covered. But this, the pure international cases in different specialties. Just we agreement with the collaboration with the embassies, with the international insurance, with the hospitals everywhere, especially in Africa, with doctors. We are working on all that to receive that cases everywhere. The potential of international cases and the medical tourism worldwide. We have the people spending more than $200 billion per year in different countries for the medical and wellness tourism. Maybe that's some statistics different, but the most important for me that the African countries, more than 55 countries with 1 billion population, and they spend 257 billion for healthcare in general. And we will go for the details now. 20% of that seeking for the treatment out of the countries. As I said, we are interested in Africa. Maybe the sample of our starting for the coming 5 years: Nigeria, Kenya, Tanzania, Somalia, Ethiopia, Uganda, Rwanda, Zambia, Zimbabwe, and Libya. And my case, maybe I have to start with that, is Nigeria. If you go through the percentage of the different specialty, like respiratory, cancer, injuries, and these injuries, including the general surgery and orthopedic, cardiovascular, NSAIDs, and the general communicable and mental diseases, you will find the percentage very huge. Especially if you back for the population in Nigeria, it's exceeding 200 million people in Nigeria. And the investment in Africa in last 10 years is amazing. And the people traveling to Europe and the people traveling for everywhere to searching for the medical tourism. We are closing. We are closing, as you see the map before, we are closing in the west area to Africa by 3 branches: Jeddah, Mecca, and Medina. 3 huge branches with 600 bed. They can covering that. If people coming for the investment in Saudi Arabia, you will find the medical care. If the people coming for festivals or touristic issue, you will find the special care in Saudi German. If the people are Muslims and coming for Hajj and Umrah, you will find Saudi German beside you. If the people coming for wellness tourism, you will find Saudi German beside you with 7 branches: north and south, east, west, and center. 7 branches distributing in Saudi Arabia to serving your client. As we cannot forget, Saudi Arabia booming now in the wellness tourism with different areas, with different cities. And by the way, we can handle the trip of your client or patient from A to Z, from door to door, starting from the evaluation of the case, the medical treatment, the cost, accommodation, meet and assist in the airport, all caring with the wellness tourism for the family, within the follow-up if the case will stay for a long time in Saudi Arabia, till back home again with Saudi German Group. And we following the Kingdom Saudi Arabia support in 2030, MOH supporting Saudi German Group in medical tourism, and the Minister of Tourism supporting Saudi German Group, Minister of Finance supporting Saudi German Group, because we created already the medical tourism in Saudi Arabia as the first group. As we said, we are around you everywhere. We are working with more than 100 nationality. We are growing the medical tourism business. We are covering all the specialties and subspecialties in different branches in Saudi Arabia, 7 branches for Saudi German Group. At the end, caring like family is our slogan in Saudi German, and we are caring like family for all our staff and our patient. Thank you very much.
Thank you so much, Mr. Ahmed, for that comprehensive take through of who Saudi German is. So I think now we'll move to the Q&A session. So I'll just be reading.
I'm sorry, Lawrence, to running in my presentation, but I need to give a brief to be light, because you will send that for all your client.
Okay.
and give a chance to answering if there is any question, any clarification, any requirements for your
Okay.
client.
No worries, we'll do that. So for now, we'll just jump into the questions and answers session. So we just have a few questions we'll be able to ask you and get clarifications, or the ones we're not able to get clarifications at this point, we can always email you for a more comprehensive.
Yes, please.
Yes. So on to our first question. From all your branches, I didn't get to hear anything about fertility, IVF to be specific. Is there any specific branch that is offering this service? And is it open to international patients, married couples, and married individuals, or how does one go about that exactly?
Yes, we support the IVF, but not in all branches, mainly on the big branches too in Jeddah and Riyadh. For all people interested in that, under the authorization of MOH, because you know in Saudi Arabia there is aggressive control in everything, especially in the IVF and the transplant. Controlling for that under the legal departments, under the approval of their minister, there is their embassies in Saudi Arabia.
Okay, one follow-up question. Is it open for unmarried individuals and as well, or just married for now?
I need to ask for that because we didn't face that before in Saudi Arabia, as
Okay.
you know. But
Mhm.
let me check and back to you for that question.
That will be okay. So, on to our second question. You mentioned Jeddah is the flagship branch as per your presentation. So, does Jeddah offer all the specialty you mentioned, or there are others that have been distributed to other branches as well?
Jeddah, covering all the specialties,
Okay.
even the liver transplant, kidney transplant in Jeddah or cardiology. We are ranked number one in the Kingdom Saudi Arabia as a group in the orthopedic, cardiovascular, all specialties and subspecialties in cardiovascular, and the transplant liver and kidney.
Okay.
So
Thank you.
German ranking number one in Saudi Arabia in that.
That's good to know. So the next question will be about the technology. What are some of the technologies you can tell us about that Saudi German has? Advanced technology or procedures that we can share with our patients or with our partners?
I can share with you later the more details, but let me inform you that we have the latest oncology and radiology equipment in SGH, the catheterization, cardio catheterization in the SGH for the orthopedic surgery and robotic surgery in SGH. We have a robotic surgery in SGH for most of renal, orthopedic, and GIT procedures. And even with some procedures we can covering by robotic surgery, we're already working on that more than 3 years now in SGH.
Okay, thank you for that. So you for the oncology, you said you're offering both chemo and surgery, if I heard you correctly.
Surgery, chemotherapy, and radiotherapy.
Okay, that's clear enough. The other question will be about the transplant. Is it limited to your Saudi Arabian nationals, or it's also open to international patients as well
Already
for
open
both
for all.
kidney, liver, and BMT?
For now, kidney and liver, it's working 100%, and we preparing the PMT, bone marrow transplant, for Saudi or non-Saudi. Just we need some requirements to be the donor from first grade family or same nationality, and they have to do some tests in their home country before coming to do the best match between the donor and recipient. For kidney and liver, we are ready 100%.
Okay. Okay, I think that should be all for now. So once again, I would just like to say a big thank you for you for the comprehensive overview of the all of your facility and the branches. Um, I think it's clear that Saudi German is just not only a hospital but offers a wide variety of things we can actually relate to. So I would pass the mic to my co-host Mokami just to give us a handover and a closing vote of thanks. Thank you.
Thank you, Lore. Thank you.
All right, thank you so much, Lauren. Before we proceed, I could see there's someone who has a question. Let's see if they're able to. All right, let me just allow them to ask their question before we produce. Olawale, are you able to hear us?
Can you hear me?
Yes, we can. Please proceed and ask Dr. Ahmed your question.
Okay. I was wondering whether you guys only allow what do you call it, text questions, or there's no room for us that are raising hand. Anyway, I have a few questions that I need clarity on. First is a request. I want to believe that is there provisions for us to have um the records of these meetings for a review, because some of us joined lately that were not able to capture some important part of the conversation. Okay, are you with me?
Yes, just to answer that question for you, yes, we are going to share with you the comprehensive information of the recording of this presentation that Dr. Ahmed has said. After this presentation, we'll be sharing with you a newsletter, and we'll
Yes,
also include numbers if you have
we
any.
can sharing that with all the communication
Yeah.
points you can do to clarify anything or asking for anything for yourself or your cases.
Okay, secondly, I would like to also ask that the medical tourism, does it factor in pregnant women that want to perhaps go for either delivery outside their states, outside the state you are covering?
You meant the if the lady want to delivery inside Saudi Arabia, it's based on the case level, but we are receiving many cases to delivery in Saudi Arabia.
What about Europe?
And SGH?
You said?
Yes, of course.
Okay. Then I also want to ask a question concerning um, what happens in the case where you have um, um, clients that are going for medical tourisms, and they've actually paid for a particular service, and it's later discovered that they have underlying issues. What happens in that regard?
You mean the follow-up of the cases?
No, 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 no. When a client is going, subscribe to a particular service.
Okay.
Okay. Let's assume that the person is going for chemotherapies and maybe any kinds of either transplant, and they discover that there is an underlying issues the person have before they could carry out the major, surgery. So what happened in that case? Is it that the client will be asked to pay more, or will be billed for that?
Look, if you mean the after the surgery, client need more care, we give packages
No,
for
no, no.
that.
Before the surgery, if there is an underlying issues that would not allow the surgery to go on, and you people did not um take what charge for that, and you discover that at the point of carrying out the surgery, so
Yes.
what happens?
Yes, yes. We already do a pre-operation, especially in the transplant investigations and updates of the case. That 100% the same, because most of the cases coming from their countries with some investigations, maybe not 100% accurate. Maybe they need to some support before the preparation. Maybe they need to stay in the hospital to prepare themselves more for that, especially in the transplant.
Okay, thank you. Then, lastly,
Please.
sorry, I mean, I used to ask question.
I'm sorry for the interruption, but we can add here also. I'm Nauf Sharif from Dr. Ahmed team. Also, we can deduct like the expenses for all the procedures which have been done for the patient, and refund the rest of the money, the rest of the amount if the case doesn't fit for the surgery. Is it clear?
No, yeah, okay. I think so. I think so.
Yeah, because
You
if we receive a case and it has been paid for that case for the surgery, we will go through so many different preparational procedures. And if the case doesn't fit for the surgery, after doing several procedures and following the medical pathway in regard of this surgery, we will deduct the amount of all what have been done for the patient and refund the rest of the amount for the patient. If you want
okay?
to ask
That's
about the financial, yeah, about the
yeah.
financial.
That's fine. And lastly, before you interject my question,
Please.
um, I want to concerning the medical histories of the patient of the clients. In this part of the world, we have clients that maybe they shuffle different types of hospitals, and they are not able to take tracks of their medical histories. So, how do you account for their medical histories? How do we help them to account for their medical history? Can't a CV suffice for that?
Yes,
Yeah, stating what they've had to go through, and the cost of their medical history.
for the medical history, you mean the second opinion appointment for the online? It's for free. If they want to second opinion, you can send it through the online, the history of the case, the paper, and
No,
I
no, no.
can.
I'm saying that you need the history from the local hospitals they've been using, right?
Okay.
So
Yes, of
some of them don't
we need
use
the
one
medical report.
hospitals.
I believe what Lawala is trying to express is if a patient does not have previous medical reports for them to get a treatment cost estimates, how do you advise them to proceed in that case?
We
For
can do.
instance, if a patient has been going to different facilities and they are not able to get all the medical reports, how do you advise he
Mhm.
proceeds in that case? Is that correct, Olawale?
Oh, you are beautiful. That is it.
All
Okay,
right,
okay.
thank you.
If the cases haven't the medical report or the case history clear, we can do one of both. Number one, we can make an tele call with the case, online call with the case to get the history through the Zoom, through the Teams call, whatever, and discuss that with the case, or receiving the case in our facility to do all that needs for the investigations. If that clear, or I'm not covering the needs.
Okay, no problem. So let's have the details and the records to digest properly, so that we can ask follow-up questions that are germane to the escalation of the project.
Yes,
All right, thank you.
you're welcome.
All right, thank you so much for your questions and also for answering us very well, Dr. Ahmed, as well as Nov. Um, as we come to the close of this webinar, I would like to thank you all for participating, Dr. Ahmed and your team for the detailed presentation, and also allowing us to even have a follow-up
This
should
one
we
now,
need to
baby.
do
Either
so after
Kenya,
the presentation.
Abi. Kenya or Togo, Uganda.
Mr. Olawale, could you
Togo.
kindly mute your mic? Thank you. So I would also like to thank all the attendees of this webinar, and also just to let everybody know, we will be sharing with you a newsletter after this, and also with that will come our contact information for anything you need, any treatment you need at Saudi German. We are here to help. My One Health, the patient support team at My One Health is ready and willing to assist with that. Thank you so much. I wish you all a good afternoon.
Thank you,
And
Mukam. Thank you very much.
yes, have a good day. Thank you.
Thank
Thank
you.
you very much.